Mesothelioma Diagnosis. If an individual has signs or symptoms that may indicate possible mesothelioma, a doctor will begin by giving the patient a thorough physical examination. Unfortunately, there are no universal screenings to detect mesothelioma in the early stages. In most cases, mesothelioma is detected in advanced stages due to the symptoms taking a long time to present themselves. In the initial examination phase, a doctor will discuss any potential exposure to asbestos, whether at home, at work, or if there were any close relatives exposed to asbestos. Also within the initial examination, a doctor will look for various signs or symptoms like fluid buildup or unusual lumps in the chest and abdomen. If a doctor finds any unusual lumps, a biopsy is needed to determine what the lump is. Various imaging tests like X-rays and kinetic scans may also be used to aid in diagnosing this disease. Removal of fluid. Depending on the location of fluid buildup, a doctor will insert a hollow needle and remove the fluid for further examination. Thoracentesis, removal of fluid in the chest cavity. Paracentesis, removal of fluid in the abdomen. Pericardiocentesis, removal of fluid from the sac surrounding the heart. Biopsies. Thoracoscopy, a tube with a tiny camera is placed through small incisions between the ribs and a small sample of tissue is taken from the chest region. Laparoscopy, a tiny camera is placed into the abdomen region and a small sample of tissue is taken. Thoracotomy, a surgical procedure that involves the opening of the chest between the ribs to check for signs of cancer. A tissue sample can be taken for testing as well. Laparotomy, a surgical procedure that involves the opening of the abdomen to check for signs of cancer. A tissue sample can be taken for testing as well. Imaging scans. Kinetic scan, computer tomography scan provides a more detailed image of tumors. MRI, magnetic resonance image typically involves a patient laying flat as they enter through a metal cylinder. The cylinder relays information back to a computer that develops an image. PET scan, positron emission tomography scans are often used in conjunction with a CT scan. Involves radioactive material being introduced to the body via an IV, helps to determine if the cancer has spread. X-ray, often the first step in imaging scans, as a doctor will take an X-ray of the chest to see if anything else might be causing the symptoms.